All right, guys, we're going to be addressing a comment. Somebody knows someone who is having this procedure done. It is called an acdf, which is anterior cervical discectomy infusion, although it just makes me think of that A, B, C, D, E, F, U, and your neck, and the pain in your head. Okay, I accepted a long time ago that I will not be a rock star. That's why we're here talking about anatomy. Let's break that down. The A for anterior is just describing the approach. So it's from the front. It's sort of a lateral front approach. The reason they do that is that it is less crowded up front versus the back has all kinds of musculature. I'll just throw up a picture. There would be a lot more disturbance from the back. Whereas here, there's a nice space that you can kind of get down into. You're going to have to move like the voice box and the swallowing tube, which can lead to swallowing issues when they put in fixation hardware. But if we're getting ahead of ourselves, cervical is going to be the cervical spine. So C1 through C7. Specifically here, we're talking about C4, 5, 6, and 7. So these three discs right there are going to be the ones that are going to be ectomied. And what does a discectomy mean? It means we're going to remove the disc. So this is microsurgery. They come in and it's assisted by a microscope. It's an orthopedic surgeon or a neurosurgeon, and they're going to come in and they're going to very delicately remove that entire disc. And so, afterwards it's going to look like this. There's instrumentation that actually keeps this space so you don't get any shifting or anything like that. And then what's going to happen is they're going to put in a bone graft, a cage, or an artificial disc. And that's going to look something like this. They're going to put it back together. Natural body process is going to come in and heal this. And hopefully through the magic, you're just going to get a fused bone. That's the fusion part of it. So you lose mobility, but you gain pain relief, hopefully. The reason this procedure is performed is that it's these discs are bulging, they're injured in some way, and are actually bulging out through the back and pushing on these spinal nerves. And these go down through your neck, and they're very complex patterns. You've seen the nervous system. And so it can have wide-ranging effects, and we want to correct that if we can. So one issue that can come up is that our voice box and our swallowing tube, the esophagus, actually is right against this surface. And sometimes, most times, they use fixation hardware. So there's a plate with actual screws that go into these bone spaces. And that can cause this channel to narrow and lead to swallowing issues. Recovery time for something like this is going to be 2 to 3 weeks where you're kind of feeling pretty good, and 3 to 6 months for total recovery. And if there's issues that arise from nerves being moved around or stuff like that, that might take up to a year. Hopefully that was enough detail. If you got questions, you know what to do.